there, are you thinking of practicing in the UK as medical doctor? Then this video is for you. I'm Dr. Esther, and in this video I'm going to be telling you how I passed my PLAB2 exam without a typical academy. If this is what you are interested in, please keep watching. So one will be asking, what is PLAB exam? PLAB means Professional and Linguistic Assessment Board Test. It's now being changed from PLAB to become UKLMA2, which is the United Kingdom Medical Licensing Assessment, and usually has part 1 as well as part 2. So in this video I'm going to be talking about part 2. UKLMA2 exam or the PLAB2 exam is usually an OSCE based exam. So for you to prepare for your PLAB2 exams or your UKLMA2 exams, you need to know the structure of its exam, and you want to know the number of stations or the marking criteria or the pass mark. In this video I'll be giving you details about this information. So this examination is an OSCE based type of examination which consists of 18 stations. We have 2 rest stations and 16 active stations. What this means is that in a group that goes into a circuit for the examination, you'll be 18 and you'll be given number tags. The rest station will be announced on that day, so it's not definite. On your day of the exam, they might tell you, oh, 6 and 11 is the rest station. So if you're starting from 6, know that you're going to be starting with a rest station. Or if you're number 5, know you're starting with an active station. So after 5, you go to 6, which is a rest station, and you continue till you're done with the exam. Okay, so for a station, usually 8 minutes. This test is being marked in 3 domains. We have the data gathering. This data gathering involves the presenting complaints, the history of presenting complaints, the past medical history. Another domain is the IPS, which is called the interpersonal skill. This involves how you relate with your patients, how empathetic you are. Then the last domain is the management. What investigation are you recommending? What's your diagnosis? What's the treatment? For each of these 3 domains, you are being marked over 4. So data gathering over 4, IPS over 4, management over 4. So cumulatively, it's going to be 12 mark per station. So for the pass mark, it depends on the exam day. Okay, previously you are meant to pass like 10 stations as well as passing the pass mark of the day, but right now the specific station has been removed. You don't have to pass 10 stations. It's not dependent on the exam day. So if you're having a difficult exam, the pass station might drop. It might be 9, it might be 10, it might be 11. If you're having a very simple exam, it might even rise to 12. So it's no longer fixed to be 10 stations to pass. So after passing the station required, depending on the exam day, you now also have to pass the average pass mark of that day. So if you pass the number of stations you're meant to pass and you don't meet the cutoff mark of the day, you have failed. If you've met the cutoff mark of the day and you don't meet the required station of that day, you've also failed. So you need to pass the stipulated number of stations for that day as well as the pass mark of that day. So how did I prepare for this examination? So after booking for the exam, I was confused. I didn't even know where to start from because the materials were a lot. Like lots of people had different things to say, so I just needed to find my bearing. God helping, I got to know about a 4-day course that is being run by a doctor, and I registered for the course. It's a paid course, it's not free, but it really helped me to navigate my bearing. I was able to know that there were other components of this examination apart from the core medical subjects like surgery, O&G, pediatrics, and internal medicine. I got to know that there was something like prescription, there were procedures, there were breaking bad news, angry patients. So you really need to find the bearing and you need to know different components of this exam. So after the 4-day course, I now had to help myself out because you need to work on the information you've been given, right? To do this, I tried joining groups. There are major groups on Telegram as well as WhatsApp where they have 3 things a day: the morning, afternoon, and evening. They discuss cases, they do recalls, and you learn, you hear people present, you can present. But I still needed to join a smaller group. You might log into these big groups and you see 100 and something people and you'll not be comfortable to present in front of everyone. Maybe you're scared of how you'll be corrected or you're shy. You might not even get the opportunity of presenting in this big group. So you really need a smaller group, which is what I did. So I joined a group of 6 people who are all candidates and who are writing exam within the same time I am writing. This is very important. After creating the smaller group, we're 6, we decided to meet twice a day. We meet around 6 in the morning, end the discussion by 8, come back in the evening by 5, and end it around 9 or 10 every day. This gave us time to join other groups to listen to what other people are saying. Another thing I'm going to be talking about is practice. I will not overemphasize. You need to practice, you need to open your mouth and talk. You listening and you talking are 2 different things. You need to talk so that it flows naturally that day. Talk in front of a mirror to watch your facial expression. Are you smiling? Do you look tense? Yeah, so practice. And hence this exam takes 8 minutes per station. In our practice group, we practice with 7 minutes so that you have more time on that day to explore your questions. So on the day of the exam, you have 8 minutes in a station, then you have 1 minute and 30 seconds to leave that station, go to the next station and start reading your question. For example, your time is done. After 8 minutes, your time is done. The 1 minute 30 seconds starts counting immediately. The timer goes off for you to leave the station, and it stops counting when you are told to enter the next station. So you really need to work on time management. So another point I'll be talking about today is materials to use. There are lots of materials to use. More materials will keep coming. I made use of Moshobi and UPS. I advise you to go through the various materials and see the one that works for you and stick to it, because the way A will present his patients will be different from the way Dr. B will also consult. So if you are picking one material to one, or use two. Some topics that were not in Moshobi, found them in UPS. So that was why I made use of the two materials. But my major material was Moshobi. As I said earlier, there are different structures of the exam. Know the different structures because it's going to help you. You need to know how to break a bad news to a patient. You need to learn your prescription, because prescription will definitely always come out. If you know how to break a bad news to a patient, no matter the question, even if it's newly formulated, you'll be able to break it because you already know the format. I don't know if you understand what I'm saying. Like, if you know the structure of each category of the exam, you'll be able to help yourself and reduce the tension of, trying to cram pro forma or cram your materials. I feel it's easier that way. And there are some other stations that usually comes out. If you've practiced CMAN, you've practiced procedure, you've practiced prescription, you've practiced teaching, you're sure of 4 stations. Another question someone who might be asking is, do you need an academy? This depends. I didn't use an academy. There are different factors that will warrant you to choose an academy. Okay, one, if you have the money, you can register for an academy. I've had testimonies of people that went through an academy and they did very well, and I've also had feedback from people that went to an academy and it didn't make sense to them. So it depends on you. If you have the money, go. But as for me, I didn't make use of an academy. The funds were not available. Another reason why I didn't need an academy is I was working as a doctor. I was practicing with my patients when consulting while at work. I was already used to examination. If you're a doctor practicing, you've done maybe pap smear, you've done venipuncture, you've done some minor procedures as well as examination. You can examine a chest, you can examine a tummy. So these are the things we do regularly at work. So the only thing I did was that I read these examination notes according to the UK standard, because maybe how we do things in Nigeria or how things are being done in whatever country you're practicing might be different from how it's been done in the UK. So I use the examination notes just to brush up my memory and be in line or in sync with what is happening in the United Kingdom. Okay, another question is, do you need a physical mock? I will say yes. I paid for a physical mock and it really helped me. I remember failing a station in my physical mock because according to my examiner, I didn't introduce myself properly. When you come into the room, you're meant to state your name and your number. He said I only stated my number, so I didn't do the exam. So he literally failed me, gave me 000. So I failed that station. So it keeps you in check. And another tip I'm going to be giving you is, please ask questions. Please ask questions. Ask questions for your visa applications, questions about the material. Ask questions, please. You can't go wrong with asking questions. You need to have more information so that you're not in the dark. You need to be well informed about this exam. So please ask questions. You can ask people that have passed. If you have more questions, you can drop them in the comment section and I'm going to be answering. Okay, another question is, when does this result come out? On the website they'll tell you it comes out within 4 weeks, but practically it comes between 3 weeks, although some people can still get their results in 2 weeks, 10 days. I know of people that got their result within 10 days, and this is the most gruesome period of this exam because anxiety eats you. You start thinking of your mistakes, but relax, breathe. I was a victim of this after the exam, so I was like, oh my god, I'm going to fail this, that. At the end of the day, I passed this exam and I passed very well. So yeah, calm down and breathe. Then finally, I'm going to advise you to pray. Pray very well. If you believe in God, pray. If you believe in anything, hold that thing tight. It can get frustrating, just God at the end of the day. Thanks for watching this video so far. If you have any question, drop your question in the comment section. I'll gladly answer. And if you've not subscribed to my channel, please do well to hit subscription button. Alright, I hope I've been able to help you, and I hope my journey journey and also help your journey. I remain Dr. Esther, and have a nice day. Thank you.